Good afternoon. This is Media Center, Ukraine, Odesa, and our next briefing is dedicated to the Ministry of Health's measles vaccination campaign in Odesa region. Our speakers are Maria Grushka, Acting Director of the Healthcare Department of the Odesa Regional Military Administration, Serhiy Dementev, Deputy General Director for Biological Factors Research, Odesa Regional Center for Disease Control and Prevention, and Liudmyla Samoilenko, expert on paediatric immunology. Maria, the floor is yours. Good afternoon, dear all present. A nationwide campaign to vaccinate children against measles has been launched in the Odesa region. Ministry of Health of Ukraine, Department of Health, and the Center for Disease Control and Prevention are constantly analyzing possible risks. And today, measles pose the largest risk of outbreak among vaccine control infections. First of all, this is an acute infection that spreads very quickly. For example, out of 10 unvaccinated people who were in contact with the patients, 9 get sick. A full-scale war, as well as restrictions during the coronavirus pandemic, contributed to the fact that certain amount of families just missed the vaccination calendar. So last year in Odesa region, only according to the national vaccination calendar, only 63% of 6-year-olds received mandatory vaccination against measles. In order to prevent the outbreak of measles, these vaccinations must now be made up and children must be vaccinated. In our region, children who missed 1 or 2 vaccinations will be vaccinated against measles. Special attention is paid to internally displaced children. In general, in the framework of the vaccination campaign in the Odesa region, 24,824 vaccinations are planned, and more than 260,000 throughout the territory of Ukraine. Therefore, until the 1st of September, until the children go in school, this group of children must receive their protection, so they must be vaccinated. We have everything for that, to make this campaign successful. We have a European vaccine, which has been received by our oblast in the amount of more than 36,000 doses. All first aid centers are fully equipped with cold storage equipment of this city. And we have 23 mobile teams and 84 temporarily vaccination centers. The medical workers are fully trained for vaccination, so our region is ready for this campaign. Children have to get 2 vaccinations with the vaccine at the age of 1 year and at the age of 6 years. If the child missed the scheduled vaccination, they should catch up as soon as possible. Children over 6 years who have not received PDA vaccination, it is recommended to enter 2 doses of vaccines with an internal at least 1 month between them. Children who have chronic asthma, diabetes, ascites, fibrosis, oncological, cardiovascular, or other chronic diseases need vaccination in the first queue. Such children are more vulnerable to infections, and course of disease are usually more difficult with more severe complications. I want to emphasize that measles is a dangerous disease, so please come to the points of vaccination and get vaccinated. There is no medicines against vaccination. The only way out is vaccination. Take care of yourself and your loved ones. Thank you, and together to victory. Thank you. Serhiy, the floor is yours. The situation with measles is very important now. Because in Ukraine, we have registered first cases of measles. And there have been 20 cases with children with measles registered. This number is not that big, but if we see the dynamics, and it has some specifics. And there are several cycles. The last cycle of the increased number of cases was in 2017, 2019. 5,500 of children were sick, and more than 65% were children of elder children. We had 7 lethal cases, including 6 among children. And during the COVID-19 pandemic, during the war, the full-scale invasion started a year and a half. We fell behind this schedule. We know that this infection is in the national vaccination plan. And so the children of up to 12 years should be vaccinated. And so there is we are not able to meet the national plan. We have calculated the percentage. Maria has already shared the details. And now we need to vaccinate more than 25,000 of children on the territory of the Odesa region. We are ready. The work started in March, and it was initiated by the Ministry of Health. And at the state committee, the decision was made. The action plan was developed in case of measles outbreak. That was a unified plan that was developed for all regions of our country. The plan was approved by the relevant commission of our state regional administration, and was spread over the administrative territory of the Odesa region. Together with the Department of Health, the work was done to prepare to this catching up campaign. We have prepared a micro plan. We involved in this process the Department of Science and Education, because children of 6 are the first grade students, and we have the second catch-up campaign for children from 2 to 17 years. These are the students of educational institutions. To avoid the spreading of this illness, this infection in children groups, we want to cover the maximum extent possible those children who have not been vaccinated yet. And we have joint orders, we have common meetings. We are fully prepared now to start this vaccination campaign on the territory of the Odesa region. Last week, our Center of Disease Control and Prevention was supported by the Ministry of Health, and we received 36,000 of doses of this vaccine, the PEDA vaccine. We have certificates. It is a quality vaccine, and it is fully safe. It is used in more than 100 countries of the world, and we are very thankful to our partners that we were able to receive this vaccine as the part of the humanitarian aid. And our center has distributed this vaccine according to the plan that was developed in April this year. The vaccine is now stored in refrigeration rooms in Podilsk and Volgograd Rayon. And today and tomorrow, we will start disseminating this vaccine among the healthcare institutions. As for the demand that exists, we need to say here that for more than 63 cases, this is the city of Odesa, Odesa Rayon, and also Belayev, Ovidiopol, and Dobroslav. These are the cities and towns who require the most attention, and a lot of unvaccinated children reside in the mentioned cities. Other territories include Belgrade and Belgorod-Dnestrovsk Rayon. And we need to vaccinate 10% children, and Podolsky, Berezivsky, and Rozdelyansky Rayon to 5% of the children that should be vaccinated. Moreover, I would like to say that on the 30th of June, by the order of the head of the Odessa State Military Administration, the plan was adopted. This is the target plan for the catch-up campaign, involving our Central for Disease Control and Prevention, the Department of Health, and the local authorities that should be also involved in this work at on the local level to cover as many unvaccinated children as possible. Apart from that, our center has additional resources, including vaccination passes. They already operative on the territory, their schedules, and the bodies which are involved in this work. These passes will be also involved in the measles vaccination campaign. We have risk groups like religious organizations, Roma population, that require more attention. And we are ready to participate in organized visits of such groups, and we're ready to transport this target population to the vaccination centers to make this vaccination service as affordable as possible. It is very important to make our services comfortable for all people who are in need of this assistance. Liudmyla Samoilenko, expert on paediatric immunology. The floor is yours. Good afternoon. To continue the topic of measles, I would like to emphasize that measles is a very dangerous disease, and it has a lot of complications among children with the chronic pathology. There are different stages of this disease, like the light form, the medium form, and the severe form. Last year, 66% of children were vaccinated according to our calendar. We can look at these numbers from other perspective. 1/3 of these children were not vaccinated. This means that there can be measles circulating in this group of population. Unfortunately, it is very infectious. If one unvaccinated person is ill, 9 vaccinated could also get ill. This means that we can again have outbreak of measles. But there are no specific medication against measles, and the against protection is vaccination. It is great that the vaccination that we received as a part of humanitarian aid is one dose vaccine. This means that if it's a multiple dose vaccine, then we can lose some stocks of vaccine. But this is the vaccine of the European quality. It is a very it is well-known vaccine of great quality. And now we can vaccinate every child now. When we have 2-dose vaccine, we need to have additional calculations to avoid losses of this vaccine. But if we can vaccinate one child, then this is great. I would like to emphasize that complications of such disease can include encephalitis, so this is the damage to the brain. This can be inflammation, lung inflammation, and we need intensive care for such children. So if we can protect our children with the help of the quality vaccine, which is used by more than 100 countries of the world, we need to use this possibility. And I would also like to emphasize that those parents who have missed vaccination, please catch up. Because if there is an outbreak of measles, it will be even more difficult because any crowds can lead to infection. And I would also like to say that those parents who refuse to have their children vaccinated also endanger those children who cannot be vaccinated because of their age. These are the children up to 1 year. And usually this leads to difficult neurologic complications. We have a question from our journalist. A journalist who has children says that they are waiting for these vaccines since spring. Do I understand right that there was no this vaccine? And the 1/3 of children who were not vaccinated, is it because of the choice of the parents, but because there was no vaccine? The vaccine that we have received, it was provided as a part of humanitarian aid. Since the beginning of the year, we had such vaccine of Belgian productions. Yes, it was not big amounts, but it was so this journalist says that she wants to have her children vaccinated, but she was told to wait. We need to understand, to study this individual case, to study the healthcare institution, because the vaccine was distributed by the regional department of health, and I have information that we were not provided with the enough vaccine. If when it comes for the period of last 6 months, so 70% of children of the first year have been vaccinated, and 30% for 6 children. But it should be up to 48%. So we need to study this individual case. Thank you. Thank you for this important information. Thank you for the briefing. So hopefully you will be here with more positive news than a possible epidemic of measles. Thank you. That was the last briefing, Media Center Ukraine Odesa for today. Please follow our announcements, and on Friday we will have several interesting events. Stay tuned.